Have you ever woken up feeling off but brushed it aside thinking it's just part of getting older? Mary did. At 68, she noticed her left hand felt a bit numb and tingly one morning. It's probably nothing, she thought. Just slept on it wrong. She went about her day, made breakfast, called her daughter, and never mentioned that strange sensation. 3 days later, Mary was in the hospital recovering from a stroke. Her doctor told her something that changed her perspective forever. That morning numbness, it was your body trying to warn you. The truth is, our bodies speak to us every day, especially in those first moments after waking. And after 60, these morning signals become even more important. What might seem like normal aging could actually be your body raising a red flag about something serious developing beneath the surface. In this video, we'll explore 7 morning symptoms that should never be ignored if you're over 60. Many of these signs seem harmless, even normal for someone your age. But medical experts warn that dismissing them could mean missing critical early warnings of conditions that, if caught in time, could be managed or even reversed. By the end of this video, you'll know exactly which morning symptoms deserve immediate attention, what they might indicate, and the simple steps you can take to protect your health. Some of these signs might surprise you. They're often dismissed by both patients and sometimes even doctors as just getting older. Stay with me until the end, because the last symptom is one that nearly 70% of seniors experience but rarely report to their doctors. It could be signaling a serious condition that, when detected early, has a much better outcome. Don't miss the final insight. It's one that most people overlook, yet it holds incredible power in predicting what lies ahead. These markers could completely reshape how you see your future and add valuable years to your life. If this has sparked your interest, show your support by hitting the like button, subscribing to our channel, and sharing this video with those you care about. Together, let's make informed choices for a healthier, longer life. Now let's get started with the warning signs you should never ignore when you wake up. Number 1. Unexplained morning headaches. One of the most commonly overlooked morning symptoms is waking up with a headache. Many people brush it off thinking they're just dehydrated or didn't sleep well, but consistent morning headaches after age 60 should never be ignored. Take James, for example. At 72, he started noticing dull headaches almost every morning when he woke up. He'd take some over-the-counter pain medication and go about his day. The headaches weren't severe, just annoying. Part of getting older, he told himself. But when his wife insisted he mention it during his annual checkup, his doctor ordered some tests. The results were concerning. James had developed sleep apnea, a condition where breathing repeatedly stops and starts during sleep. His brain was being deprived of oxygen at night, triggering those morning headaches. Left untreated, sleep apnea doesn't just cause tiredness. It significantly increases the risk of high blood pressure, heart attack, stroke, and cognitive decline. But morning headaches can signal other serious issues too. They might indicate high blood pressure, a warning sign for stroke. They could suggest brain tumors, which often cause increased pressure in the skull during the night when you're lying down. In some cases, they're an early warning of carbon monoxide poisoning, particularly if others in your household are experiencing similar symptoms. What's most concerning is how easy it is to dismiss these headaches. You wake up, feel discomfort, take something for pain, and by the time you've had breakfast and coffee, the headache has often eased, making it easy to forget until the next morning when the cycle repeats. Here's what you should do. If you experience consistent morning headaches more than twice a week for 2 weeks, make an appointment with your doctor. Keep a simple log noting the intensity, location, and how long each headache lasts. Pay attention to whether the pain is sharp, dull, focused in one area, or generalized across your head. This information will help your doctor determine the appropriate tests. Don't be tempted to just manage the pain with over-the-counter medications. Finding and addressing the underlying cause could quite literally save your life. If you're still watching this video and finding these insights valuable, please comment "morning check" below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any future videos that could protect your health. Now let's move forward. Number 2. Morning dizziness or lightheadedness. The second morning symptom that requires attention is feeling dizzy, lightheaded or unsteady when you first get out of bed, while it might seem normal to feel a bit wobbly after lying down all night. Persistent morning dizziness after 60 is your body trying to tell you something important. Consider Eleanor's experience. At 65, she began noticing that when she stood up from bed each morning, the room would spin slightly. She'd grab her nightstand, wait for it to pass, and then continue her morning routine. Just getting up too quickly, she reassured herself. After a few weeks, she fell in her bathroom one morning, narrowly missing hitting her head on the sink. What Eleanor didn't realize was that her morning dizziness was a sign of orthostatic hypotension, a sudden drop in blood pressure when changing positions. This condition becomes more common as we age and can indicate several underlying issues, from dehydration to medication side effects to more serious cardiovascular problems. Morning dizziness can also signal inner ear disorders affecting your balance, low blood sugar, especially important for diabetics, or even early warning signs of neurological conditions. What makes this symptom particularly dangerous is the increased fall risk it creates, and falls are one of the leading causes of injury and loss of independence in adults over 60. For many seniors, this dizziness happens so quickly that they hardly register it as a medical symptom. They've adapted by moving more slowly or holding onto furniture when first getting up. But this adaptation masks the warning signal your body is sending. Here's what to do if you experience morning dizziness. First, make changes to how you get out of bed. Sit on the edge of the bed for a full minute before standing up, giving your body time to adjust to the position change. Stay hydrated by keeping water by your bedside and taking a few sips before getting up. More importantly, report this symptom to your doctor, especially if it's new or worsening. Be specific about when it occurs and whether it's accompanied by other symptoms like ringing in the ears, nausea, or vision changes. Your doctor may need to review your medications, as many common prescriptions for high blood pressure, anxiety, or sleep can contribute to morning dizziness. Don't wait until after a fall to address this symptom. By then, you might be dealing with much more serious consequences like fractures or head injuries. Taking action when you first notice morning dizziness could prevent an accident that changes the course of your independence. Number 3. Unusual morning stiffness or joint pain. Many people over 60 expect some stiffness when they wake up. It's so common that most don't even consider it a symptom worth mentioning to a doctor. But there's a difference between general morning stiffness that improves quickly after moving around and the type of morning pain and stiffness that signals something more serious. Take Robert's case. At 67, he'd always been active, enjoying daily walks and gardening. He began noticing his hands and wrists were exceptionally stiff and painful each morning, sometimes taking over an hour to loosen up. Just arthritis acting up, he thought. But when the stiffness began lasting longer and affecting more joints, his daughter convinced him to see a rheumatologist. Robert was diagnosed with rheumatoid arthritis, an autoimmune condition that, if left untreated, can cause permanent joint damage and disability. Because he caught it relatively early, he was able to start treatments that significantly slowed the progression and preserved his joint function. Morning stiffness that lasts more than an hour, particularly if it's symmetrical, affecting both hands or both knees, for example, can be a classic sign of inflammatory conditions like rheumatoid arthritis. But unusual morning pain could also signal other conditions like polymyalgia rheumatica, a painful inflammatory disorder that primarily affects people over 65 and requires specific treatment. Even if you've already been diagnosed with osteoarthritis, the wear and tear type, a significant change in your morning pain pattern deserves attention. It could indicate that the condition is progressing or that something else is developing alongside it. What makes this symptom easy to miss is that it often improves as the day goes on, making it easy to forget by the time of a doctor's appointment later in the day. Many seniors also accept increasing pain as an inevitable part of aging, rather than a treatable condition. Here's what to do. Keep track of your morning stiffness, how long it lasts, which joints are affected, and whether it's getting worse over time. If stiffness regularly lasts more than an hour after waking, or if the pain is severe enough to limit your morning activities, it's time to consult with your doctor. Don't just reach for pain relievers to mask the symptoms. While they may provide temporary relief, identifying and treating the underlying cause can prevent permanent damage and help maintain your mobility and independence for years to come. Remember, joint damage from conditions like rheumatoid arthritis can't be reversed once it occurs, making early detection crucial. If you're still watching this video and finding these insights valuable, please comment "Joints Matter" below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any future videos that could protect your health. Now, let's move forward. Number 4. Morning vision changes. When you open your eyes in the morning, what you see or don't see can provide critical clues about your health. Vision changes that are most noticeable upon waking deserve immediate attention, especially after 60, yet they're frequently dismissed or attributed simply to aging eyes. Consider Martha's experience. At 73, she began noticing that when she woke up, her vision in one eye seemed cloudy, almost like looking through wax paper. By mid-morning, it usually improved. She assumed her eyes were just dry or tired and put off mentioning it during her regular checkups. When she finally did, her ophthalmologist discovered she had a developing cataract that had progressed significantly, along with early signs of glaucoma, a condition that can lead to blindness if not treated promptly. Morning vision issues can manifest in several ways. Blurry vision that improves throughout the day, seeing floaters or flashes of light, dark spots in your field of vision, or even temporary loss of vision in one eye. While some changes might be related to simple dryness overnight, others can signal serious conditions like glaucoma, macular degeneration, retinal detachment, or even warning signs of a stroke or transient ischemic attack, TIA. What makes these symptoms particularly concerning is that many eye conditions progress painlessly and gradually, making it easy to adapt and not notice the slow deterioration. Additionally, vision changes that occur primarily in the morning might resolve as the day progresses, giving a false sense that all is well. Here's what you need to know. Any sudden change in vision should be treated as an emergency, warranting immediate medical attention. Even if the symptom improves after a few hours, the underlying cause could be serious. For more gradual changes that you notice primarily upon waking, make an appointment with an eye specialist within the week. Before your appointment, make note of exactly what you experience, whether it affects one or both eyes, how long it lasts, and if any activities make it better or worse. Don't adjust your morning routine to compensate for vision problems without seeking medical advice. For example, turning up lights brighter, increasing the font size on your devices, or avoiding certain tasks that have become difficult could mask important symptoms that need attention. Remember, many serious eye conditions can be treated effectively if caught early, but may lead to permanent vision loss if ignored. Your vision is precious. Don't risk it by dismissing morning eye symptoms as just another sign of getting older. Number 5. Difficulty speaking or forming words in the morning. One of the most concerning yet frequently overlooked morning symptoms is difficulty speaking clearly when you first wake up. While it's normal to have a slightly hoarse or gravelly voice upon waking, struggling to form words, slurring speech, or having trouble finding the right words could be warning signs of something serious. Take Thomas's story. At 71, he occasionally noticed that when he first woke up and tried to speak to his wife, his words came out slurred, almost as if his tongue wasn't working properly. After about 15-20 minutes and some coffee, his speech would return to normal. He didn't mention it to anyone, assuming it was just morning grogginess or perhaps even a side effect of his blood pressure medication. During a family gathering, his daughter, a nurse, overheard him in the early morning and immediately recognized the potential warning sign. She insisted he see a doctor. Tests revealed Thomas had experienced several mini-strokes or transient ischemic attacks, TIAs, during sleep. These TIAs are often precursors to a major stroke, but because they typically resolve quickly, many people, especially seniors, dismiss or don't even notice them. In Thomas's case, catching these warning signs early allowed his doctor to adjust his medications and recommend lifestyle changes that likely prevented a more severe stroke. Morning speech difficulties can signal several serious conditions. They might indicate a TIA or stroke affecting the language centers of the brain. They could suggest neurological conditions like Parkinson's disease, which often causes speech to be more affected after long periods of rest. In some cases, they might reflect sleep apnea, which can cause temporary morning cognitive impairment that affects speech. What makes this symptom easy to miss is its transient nature. By the time most people are fully awake and have had breakfast, their speech has often returned to normal. Many seniors also incorrectly attribute these episodes to senior moments or normal cognitive aging. Here's what you should do. If you or a loved one experiences any change in speech pattern upon waking, even if it resolves quickly, contact a doctor immediately or go to the emergency room. Unlike some other symptoms we've discussed, speech changes can be signs of an active or impending stroke, which requires immediate medical intervention. Ask a family member or caregiver to record your speech during an episode if possible, as this can be valuable information for medical professionals. And don't be embarrassed about seeking help, even if your speech returns to normal by the time you see a doctor. Explaining exactly what happened, when it happened, and how long it lasted can provide crucial diagnostic information. Remember, when it comes to stroke symptoms, minutes matter. The faster you receive medical attention, the better your chances of preventing permanent damage. If you're still watching this video and finding these insights valuable, please comment "Morning Alert" below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any future videos that could protect your health. Your support helps us continue creating good content to inform and inspire you. Now let's move forward. Number 6. Persistent morning cough or chest tightness. Waking up with a cough or feeling of tightness in your chest might seem like a minor annoyance, but after 60, these morning symptoms can indicate several serious conditions that shouldn't be ignored. Consider William's experience. At 76, he developed what he called his morning ritual, about 10-15 minutes of coughing after getting out of bed. It wasn't particularly severe, just persistent. He assumed it was related to the dry air in his bedroom, or perhaps seasonal allergies. When his grandchildren came to visit, they noticed his daily coughing fits and urged him to see a doctor. Tests revealed William had developed heart failure, with fluid building up in his lungs overnight while he was lying flat. Morning coughing, especially if it produces phlegm or is accompanied by shortness of breath or chest discomfort, can signal several conditions that are common in older adults. Heart failure often causes fluid to accumulate in the lungs when lying down, leading to coughing upon waking. Uncontrolled acid reflux can irritate the throat and lungs during sleep, causing morning coughing. Respiratory conditions like COPD or undiagnosed asthma often worsen overnight and produce more symptoms in the morning. What makes these symptoms particularly easy to dismiss is that they often improve as the day progresses. Once you're up and moving around, fluid shifts in the body, airways open up, and the coughing or chest tightness may subside, making it easy to forget about it until the next morning. Many seniors also mistakenly attribute these symptoms to normal aging or the lingering effects of a cold they had weeks ago, rather than recognizing them as new or worsening conditions that deserve medical attention. Here's what you need to do. If you experience regular morning coughing or chest tightness that lasts more than a week, contact your doctor. Be specific about when the symptoms occur, whether you produce any phlegm and what color it is, and if you have other symptoms like swollen ankles, fatigue, or shortness of breath with activity. While waiting for your appointment, try elevating the head of your bed by using extra pillows or placing blocks under the headboard legs. This can help reduce nighttime fluid buildup in the lungs or minimize acid reflux. But don't rely on this as a solution. Proper diagnosis and treatment are essential. Remember, conditions like heart failure are often very treatable when caught early, but can become life-threatening if allowed to progress. A persistent morning cough is not something to tough out or accept as inevitable with age. Number 7. Severe morning fatigue. Despite adequate sleep. Our final morning symptom might be the most commonly experienced, yet the least reported to doctors. Waking up feeling exhausted despite getting enough sleep. While everyone has occasional mornings when they don't feel rested, persistent morning fatigue after age 60, even after 7-8 hours in bed, should never be dismissed as just getting older. Take Helen's case. At 69, she found herself waking up feeling as tired as when she went to bed, despite sleeping for over 8 hours. Coffee would help temporarily, but by mid-afternoon, she'd be fighting to stay awake. She began canceling social activities and limiting her volunteer work, thinking she just needed to accept her new normal with age. When her daughter visited for a week and noticed how exhausted Helen seemed every morning, she insisted her mother see a sleep specialist. Testing revealed Helen had moderate to severe sleep apnea, where her breathing stopped repeatedly throughout the night, preventing her from reaching the deep, restorative stages of sleep. With proper treatment, her energy levels improved dramatically within weeks and she returned to her active lifestyle. Morning fatigue can signal numerous health issues common in older adults. Sleep disorders like sleep apnea, which affects nearly 50% of seniors but is diagnosed in far fewer, prevent restorative sleep. Thyroid disorders, particularly hypothyroidism, often cause severe morning fatigue. Heart conditions that reduce oxygen flow during sleep can leave you exhausted upon waking. Even certain medications commonly prescribed to seniors can disrupt sleep quality without affecting sleep quantity. What makes this symptom so easy to overlook is how gradually it often develops. Many seniors slowly adapt to lower energy levels, reducing activities and accepting fatigue as inevitable with age. They might not even mention it to doctors unless specifically asked about energy levels. Here's what you should do. If you consistently wake up feeling unrested despite adequate time in bed, talk to your doctor about sleep quality, not just quantity. Consider whether you have other symptoms like snoring, gasping during sleep, which a partner might notice, morning headaches, or difficulty concentrating during the day. Before your appointment, keep a sleep journal for a week, noting when you go to bed, when you wake up, and how you feel in the morning. Also note if you wake during the night, or if your partner has observed any concerning sleep behaviors. Don't try to compensate for morning fatigue with excessive caffeine, as this can mask an underlying condition and potentially make some heart or blood pressure issues worse. Instead, focus on getting a proper diagnosis and treatment. Remember, severe morning fatigue is not an inevitable part of aging. It's a symptom that something isn't right, and in many cases, the underlying cause is highly treatable. Addressing it could significantly improve your quality of life and prevent more serious health complications. If you're still watching this video and finding these insights valuable, please comment "Energy Matters" below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell, so you don't miss any future videos that could protect your health. Your support helps us continue creating good content to inform and inspire you. We've covered 7 critical morning symptoms that should never be ignored after 60. Unexplained headaches, dizziness when getting up, unusual joint stiffness, vision changes, speech difficulties, persistent coughing, and severe fatigue despite adequate sleep. Each of these can be an early warning of serious conditions that, when caught early, often respond well to treatment. The pattern is clear. Our bodies often send their strongest warning signals first thing in the morning, when systems are reactivating after hours of rest. These signals might fade as the day progresses, making them easy to dismiss or forget. But doing so means missing valuable early warnings that could protect your health and independence. Think of these morning symptoms as your body's alarm system. Just like you wouldn't disconnect a smoke detector because the beeping is annoying, you shouldn't ignore these health warnings because they're inconvenient or concerning. So what should you do now? First, reflect on whether you've experienced any of these morning symptoms. Have you been dismissing headaches, dizziness, or fatigue as just part of getting older? Have you noticed changes in your vision, speech, or breathing that seem most pronounced when you first wake up? Second, start keeping track. Many of these symptoms follow patterns that can help your doctor make an accurate diagnosis. Note when they occur, how long they last, and what seems to make them better or worse. This information can be invaluable during medical appointments. Third, don't wait to seek help. Many seniors delay mentioning new symptoms until their next scheduled checkup, which might be months away. For symptoms like morning speech difficulties or sudden vision changes, waiting could mean the difference between effective treatment and permanent damage. Remember Mary from the beginning of our video? Her morning numbness was her body's warning sign of an impending stroke. Had she recognized it and sought immediate care, her outcome might have been very different. Your morning symptoms are telling you something important. Listen to them. Act on them. They could be giving you the gift of early detection, perhaps the most valuable gift of all when it comes to your health after 60. Thank you for joining us today. We'd love to hear from you. Leave a comment below sharing which of these symptoms surprised you the most or if you've had experience with any of them. Your thoughts are important to us, and sharing your experiences might help another viewer recognize an important warning sign. If you found this video helpful, please like, subscribe, and share it with someone you care about who's over 60. Your support helps us continue creating content that could make a real difference in people's lives. Thanks for watching, and we look forward to seeing you in our next video. Stay healthy, stay alert to your body's signals, and remember, when it comes to these morning symptoms, it's always better to check than to regret.